Come on in, folks. Come on in. Don't be shy. Come on in, folks. Come on in. Don't be shy.
They can't come through the screen, Bob.
Yeah, they can. They can. Come on. Join our world.
You've been watching Walt Disney
It's the
again.
Bob and Brad world. Come on.
And we got the spine here today, naturally.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, Brad, we're going to discuss mattresses and sleep position for back pain, sciatica, neck pain, hip pain. We're going to discuss it all. And we're going to show you the right positions you want to be in and some of the products that you may want to get to make your sleeping a lot better, because it's important to get your sleep, isn't it right, Brad?
Yeah, it is, Bob, and pain-free sleep, because then you sleep all night.
And you know what else is important, Brad?
Oh.
If you haven't already subscribed to us, make
yeah.
sure you go over to YouTube and subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. It's also important that you go over to the Facebook and like us, because Brad and I, as children, we're not liked. It's a sad, sad tale, and we're trying to turn things around. And we're doing pretty good at it, aren't we, Brad?
Yeah, I think so.
By the way, we on Facebook, we're Bob and Brad. Don't look up for physical therapy video. We're Bob and Brad, so that's
Right.
the key.
You can look at Bob and Brad
On YouTube also.
anything. Yeah, Bob and Brad is getting pretty popular.
All right, so the way we're going to run this show is the way we always run it. We usually go over our program, and it's going to be a fairly lengthy one today, but we will take some questions and answers after we're done.
Sure.
Let's talk about the first thing that we're going to discuss, Brad, back pain.
Mm-hmm.
Now, let's say you have run-of-the-mill back pain, arthritis, degenerative disc disease, spinal stenosis, or
Spondylolisthesis.
Right.
It's a mouthful.
in all those cases, a lot of time the back is going to feel a little bit better to be a little bit slightly curved like this.
Mm-hmm.
This is taking stress off the joints on the back of the back, if there is such a thing.
Facet joints, we call them.
So you might want to have a softer mattress, or Brad's daughter just tried this. Is it a foam topper?
It's a memory foam. As a
Memory
matter of
foam
fact,
topper.
I use one when I go camping on my cot, and it's made a significant difference, whether it's on the bed for my daughter. She just loved it. She was at a dorm,
Sure.
in college, and she got one of those and just fell in love with it. So I had to get one for camping just because. And I think I'm going to get one for our bed at home, as a matter of fact.
We'll try to make sure we link this down below in our preferred Amazon products. That's going to be all the products we're going to try to mention today. It's not there yet. It won't be on Facebook yet. We'll have it there within an hour or so.
Sure.
All right, so a softer mattress or a foam topper. You're going to maybe, with some of you people, I know, you actually maybe want to have your head elevated or your legs elevated. So we got two different devices you can use for that. These, by the way, are really nice if you like to read in bed, because there's no good way to read in bed if you're just using, you have money falling out of your pocket, Brad.
Giving you a tip, Rob.
So, there's no good way to stack pillows up and read in bed. You're just going to make your neck really flex. This is a lot better way to try to watch TV or read in bed. But it also is putting your back in a little bit of slight flexion, which makes it feel better. For some of you people, because I've had patients that had to sleep in a recliner. Have you, Brad?
Oh, yeah.
A lot of them with back pain. And this might be an alternative. And this is the leg wedge. And Brad's a big fan of this one. My wife likes this one too.
Right.
She likes it on the couch when she's watching TV.
Sure.
So
Right. Now, you might position yourself. I don't know if you would sleep like this all night long, but you're going to use it. You can always, when I use one of these at bed, at night in bed, usually 2-3 hours in, I'll put it off to the side.
you dump it off to the side.
Yeah.
Okay. All right. And the same with this. I don't know that, like you said, that you'd sleep all night long with that, but it might be a thing that allows you to get to bed.
Right. For reading or TV watching.
If you don't want to use any of this stuff, you might just try sleeping on your side with your legs curled up a little bit. And why don't you lay on your side, Brad?
This feels so good. I got spondylolisthesis, and I can just tell you, this feels really nice.
It's a good position for you, isn't it, Brad? So, no, I was going to take that and put it between your legs, Brad.
Well, I need a pillow for my head.
There we go.
No, I don't like the wedge pillow. Give me another pillow, Bob. Be nice. Get rid of that.
All right. So there we go. Again, so the back is slightly curved. We got the facets; they're not taking the stress, and you got the pillow between the legs. So that's a good way to go ahead and do that. Another one, my wife actually, and we'll talk about this one with the knee. She actually likes, I don't know what this is even called. We have it down below. It's a wedge for between the knees, and it really keeps you in place. My wife really likes it. I bet you she's not even happy that I've stolen it from her right now. You better make sure you bring it back tonight. So
yeah,
all right,
take that home with me.
Keep things rolling, Brad. Let's talk about a herniated disc, a bulging disc, or sciatica. Different story now. Now you don't want to have your back in that slightly bent position. You're going to want to probably have a firmer mattress. You might even try to see if this works. Try your mattress on the floor and see if obviously that's going to be a little more firmer than having a box spring underneath it, and see if your back feels better at night. Now, one thing you might try is the rolled. Where's that, Brad? Here it is. You can take, you can roll up a sheet. Okay. You can roll up a sheet or a towel, and you can put it around your back like this, your low back, and that's going to put a little bit of concavity in your back all night long, which is good. What you're going to want to have that for a herniated disc. I'm sorry, Brad. So what this does, if he's laying on his back, his back isn't sagging, there's support, but also if he lays on his side, it fills in the gap there too. So you can just do this with a rolled up towel or sheet, or you can go ahead and get the McKenzie sleep roll, I think it's called. Isn't it, Brad?
Sleep roll, exactly.
Yeah, so
it's got a little tie so you can do this. This one is actually for a smaller person than me, but they look exactly the same.
what I would recommend is try the sheet first, rolled up sheet.
Oh.
That way you'll know if it helps. And if it does help, then you maybe want to go ahead and purchase one of these, because for the long term, it's just going to be a lot easier to use.
Yeah, and that cushion, it just feels better than the towel roll. But
So again, if you lay on your side, Brad, with that roll, again, I would put pillows between the legs again.
oh, yeah, stock up on pillows.
Yeah, you're going to want to get
Or
just
just
stock in pillows.
Go take them, from your significant other, the kids, whatever, the neighbors. Just tell them you need them for a little while until your back gets better.
That's right. You'll bring them back. So another one, Brad. This one's a little bit, wouldn't be, I'd say, an all night long, but we start treatment a lot of times with people having a couple pillows underneath their stomach or laying on their stomach.
Sure.
So he's going to show you this. This is how we often start treatment of a sciatica problem or a bulging disc or a herniated disc. And you're laying like this, and then over time you actually try to pull pillows out, and eventually get down to no pillows on your stomach.
Oh, wow.
There we go.
It is a trick with the
Yeah.
patient too, especially if they're in pain. But
Yeah.
you get it figured out.
If you're pregnant, no, you can't do this one. But Lonnie was just asking you out if you're pregnant. If you're pregnant, you're gonna have to lay on your side probably.
That's a good point.
Yeah, it is a good point. All right, next one, Brad. This one is a little bit different way to do it. We've done this one before. Let's lay on your side. Yep. Let's say your sciatica pain is going down this leg. This is a little trick you do. You actually put you can put one pillow or two pillows underneath your heels like this, and he's got a pillow underneath his head.
Oh, thank you. I'm gonna double that up so we get a little more.
And sometimes what this does is it turns the pain off, doesn't it, Brad? It actually stops the pain from going down the leg. So if you're having trouble sleeping with sciatica, give this a shot. It may help.
Right. And it's one of those things, if it works, you'll know right away. If it doesn't, well, you can take the pillows out.
Right.
I've had it work with some patients, and they just love you for it.
If it doesn't work, blame Brad, because
Yeah.
he's the one that's it's his idea initially.
I can accept it.
All right, let's go to the neck, Brad. With a neck problem, you probably want a firmer mattress, because I don't want you a soft one that you're sinking in like this.
Yeah.
With the neck, you're laying on your back, you're going to want to have a thinner pillow. You want to show that, Brad? Because if you had thick pillows, he'd be up like this. You want to have the ears lining up with the shoulder almost. You want to have your neck in neutral, what we call it. Now, if Brad lays on his side, now he wants to have two pillows or double up his pillow, because otherwise his neck would be bent down. Your head would be bent down if we only had one pillow. So,
And I think a lot of people, you just fold it in half so you don't have to have a spare pillow
Well, I think some people put their arm underneath there too, which is probably not the best thing to do if you're having neck pain or because now you're going to start developing shoulder pain.
Yeah, for now, one thing, it's another.
All right. The contour pillows, Brad, they often work well.
We got 2 of them over there.
Yeah, we got 2. All right. I'm coming back. Don't worry.
Yeah,
I haven't abandoned you.
I don't want to solo this.
Now, if you want to try something like this without buying one of these, you can take a rolled towel and put it in your pillow. You want to try that, Brad?
Yeah.
So we're gonna fill in the gap here. So there's a little, that little arch inside your neck there. So now look at that. He's created a little gap there, a little something to fill in the canal. And so try that. Does that feel better? If it feels better, maybe you want to try one of these, pillows here. You can see it's got the contours here. This is more of a memory foam one. The problem with these that I have found is it's a very, really changes from person to person. I mean, it's right. My daughter, she found one that she just loved, but she had to buy one that she hated first. Yeah. In fact, that's this one right here, Brad. She didn't like this one.
Yeah. And
then she found the one that she loved. So I don't know. I don't know if you're even allowed to try them and then send them back or not. I suppose you can't take them out of the package.
I think it's like a toothbrush, Bob. It's yours.
Yeah, right. Once you've opened the package, it's all yours. So not much you can do with that. So a couple other neck hints that you might try. Some people, especially if you're having just an acute bout of pain, you can take a pillowcase, you fold it in half lengthwise like this, and then fold it again and create a little neck collar for you. Just go all the way around like this and pin it in place. And it just gives a little support for your neck. I've had some patients that like this. It's just an easy thing to try.
Right.
See if it works. So
you're going to sleep like that with your regular pillow.
Yep. You sleep with your regular pillow, just giving this a shot and see if that helps or not.
Yeah.
So
you could just use some tape to it to hold it, for one night.
Oh, yeah, exactly. You wouldn't have to use a pin. Pins always worry me at night. You're going to pinch into your carotid artery or something like that. So
if you don't pin it properly.
Right.
Something.
All right, let's go on to hip pain, Brad. With hip pain, I would also say you probably want a softer mattress because if you lay on your side at all, you want to make sure you have some cushioning for that.
This is where I think that memory foam insert.
That topper?
That topper, yes.
Yeah. You like thought the Serta one was a good one, right?
Right. Well, I think that's when we
you think
bought
it was?
Serta.
Oh, okay.
Mm-hmm.
Are you certain about that? That's a little therapist humor. Are
You're
you certain
killing
about
me,
that?
Bob. No.
All right. Now with the hip, the first point is if you're having pain in one hip, don't lay on that hip if you can at all avoid it. And I know some of you are creatures of habit. You've laid on the same side all your lives, and it's really difficult to change. We'll show you something to try for that. But right now, let's assume that the top hip is the painful one. Even there, you'd want to make sure you have a pillow between the legs, or maybe this little supporter again, because it's putting a stretch on the hip if it's not there.
Right.
You can see that, can't you?
Particularly if you
especially if you do that. Right.
So the pillow can help remind you to keep it where it belongs too.
If you lay on your back, I would try to put a couple pillows underneath your knees.
Oh yeah.
Or again, the leg wedge would work out good for this.
Yeah. If you like pillows, you'll probably like the leg wedge more.
Yeah, it's just going to be a lot easier. The pillows, it puts the hip a little bit into flexion, takes some of the stress off of it, but not like the leg wedge. Where'd our leg wedge go?
It vanished.
Oh, it's here.
Thank goodness.
But this is going to feel better.
Oh, yeah.
And you can help with the swelling in your lower legs. You can help push it up into where it should be.
Get gravity working for you.
All right, let's say you're just bound and determined you're going to sleep on that painful hip.
Okay.
All right.
Because that's the way if I always slept, and that's the way Grandma slept, and that's the way I'm sleeping.
That's why my great-great-grandma slept that way. So what you're going to want to do is try to get off the point of the hip. So now instead of being all the way over like this, see if you can put a pillow behind you like this. Give yourself a little support.
Yeah.
And now you can get more onto the meaty part of the buttock.
Sure.
So now he's not right on the point. He's a little bit off. You could even put a pillow here.
There you go.
And another pillow between the legs.
There
Again, we told you you need to have stock and pillows here.
I could use another one, Bob.
So this is
Give me that one.
this is the sandwich here basically we're creating.
Well, you want to sleep on that sore hip, then you're going to get some sleep there.
So now you can see he's leaned back a little bit and he's not putting stress on the hip point of the hip itself. Usually that helps a lot.
Yeah,
So,
getting more of that gluteus maximus muscle, the big cushy muscle.
all right, let's say we go into knee pain. Be the same thing with the knee pain. You want to probably have something like this. My wife was having knee problems. She used this along with some stretches, took it away.
Sure.
So it really helped out. You can use the pillows too. That'll work. If you lay on your back, again, it's going to be the same thing again. It might feel better to have your knees bent a little bit.
Yeah.
If you have them straight all night long, it's probably going to bother them. And so again, you got the leg wedge, you got the pillows. One of the two should do the job.
But let's make a point, Bob. Those of you who had a total knee replacement and just had a surgery the last month or two.
Yeah, they don't want you putting a pillow underneath your knee
Right.
after knee replacement. You couldn't put a pillow here.
Sure, under your calf.
On your calves and put a little stretch on you.
Yeah.
So, but no, they want that knee straight all night so that we can get a little stretch on it. So let's go to the final one, Brad. Let's talk about the shoulder. When you're sleeping and you got a shoulder problem, it's the same as the hip. We're going to really recommend that you don't sleep on that shoulder. We'll discuss what to do in case you feel like you have to. Let's pretend first this is the painful shoulder. So number one, you're going to lay on your side, and this is going to take lots of pillows because you're going to have one here, and then you're going to put another one under here. But you might even use three.
It depends how thick your pillows are.
How thick they are, but and how the shoulder feels. It's very individual for people. But can you see how it keeps his shoulder? Now it's not internally rotated. He's kind of got it in a good position here. Very comfortable. I think this is the most recommended position for the shoulder that I would say.
Right.
So,
And again, the body size of the person. All these.
yeah,
things
you
are
have to
different.
you're going to have to work with this. It's always an experiment. Now let's pretend, Brad, you're being that stubborn old fool that you normally are. That stubborn old fool.
Yes.
So now he wants to sleep on his bed, on his shoulder that's involved. So what we got to do is you got to create the big canal, the Suez Canal here. So you're going to use a pillow here, probably two pillows, right? Because you're on your side. You're creating a canal here. He's going to put the shoulder into the canal. And now because he's got support here and here, he's not putting as much pressure on the shoulder, right?
And if you pull that shoulder,
if you pull it forward a little bit, it's going to even be better.
take some more.
And again, he's maybe back a little bit like this. It's just going to feel a lot better. If you're laying on your back itself with the shoulder, I'd still use a pillow under there. Wouldn't you, Brad? Some type of support.
Oh, you mean
Like this.
Right.
Yeah.
That helps elevate it a little bit. It just gets it out of in that position, and you'll know if it feels better, it's the right position to do. If it stays feeling better, it allows you to sleep better. You're doing well.
You're doing the right thing, and you're gonna, like I said, you're gonna have to work around with this. All right, Brad, we're to that point in the program
really?
where we can actually take questions.
Question and answer
Yeah.
time.
Lonnie, do you got anything? Okay.
Nothing.
How would you use sheets or covers when you need to use all those pillows?
It's a good question. You just have to, hopefully you don't have a lot of sheets and covers, but you get yourself positioned properly with the pillows. And it does help to have a second person cover you up because then your pillows will stay in place. But that does create a little bit of a problem. Lighter, fluffier down comforters, that kind of thing can be make it a little easier. So yeah, that is one of the challenges.
I'm glad you're answering because I didn't know what to say.
Well, Bob, I just let it come right out.
Someone they got Piriformis. They said, would you review the stretches to fix Piriformis or maybe Sciatica? You want to show the Piriformis stretch, the standard one?
The supine.
Yeah.
Yeah. We can do this one. I got two of them actually. I don't know if you use this one where you pull the knee.
I pull the knee over,
over to the opposite shoulder, not real aggressive. And usually I'll have the person do the other one, the one that doesn't hurt, and then the one that does hurt, and then you get a better feel for how far a healthy Piriformis stretches.
My sister just contacted me. She's having trouble with Piriformis syndrome. She said she's had it for years.
Yeah.
And I sent her our video on stretches, but I said the one thing that has helped almost everyone that I've had that got better was they did massage to the area.
Sure.
And really one of the best ways to do it is get the Pure Wave massager. I'm not just trying to say this to sell these because I just don't know how you're going to massage your butt for the length of time that you need to get rid of Piriformis syndrome. I mean, you need to really hit massage pretty deep and pretty for long periods of time.
I'll do my own Piriformis.
Yeah, I told her that I actually had given one of these to my mom, so she's gonna get it from my mom, and I told her she could do it twice a day. You start by going around the non-painful areas, and then eventually you work over the painful area if it can tolerate it. But that really is the better way to treat Piriformis syndrome.
Yeah, if you don't want to buy one of these, you can do it by hand, or you can use this tennis ball in there and use that. That's pretty aggressive, but it does. You can certainly work with that.
So what do I do when I have all the issues?
When you have someone ask what to do. Wow.
Yeah.
Well, I would say one, for most issues, if you have sciatica, which position you want, you're probably going to lay on your side, but keep your back fairly straight.
I'm going to say if I have a patient that has a number of issues, I say which is the one, if you got rid of, would be the most helpful.
That's a good point,
And
Brad.
then I focus
Bravo.
on that one.
Yeah. What's the worst one? And start with that and position yourself that way. And then see some of the other ones maybe will feel better in that position
Can
too.
be a chain reaction, because sometimes the one painful spot, if it is, oftentimes it is a low back that relates to the shoulder, may relate to the neck because it's all connected in a chain. So that would be the approach that I would recommend.
Someone was asking about ergonomic keyboards and what we think about those. I will
In
address
bed?
it. No, this is a different subject now.
Okay.
They used to, and I don't know if you remember this, Brad. Why don't you sit up once, do you mind? I remember when they first came out, for a while, they were talking about keyboards, split keyboards. Do you remember that? And they had them like this. I would say the only thing that I would say about a keyboard is one, when you're using a keyboard, you want to make sure this part of the arm is completely vertical. You're not over like this. You're not like this. And you're going to want the hand as either in neutral, so you don't want the wrist up like this or down like this, and sometimes even a slight slant downward is even good.
Sure.
So what I actually do is I actually take my keyboard, I have it on a board, a lap board, and I put it on my lap like this. So this puts me in a good position for the keyboard. I wouldn't worry about what keyboard you have. I worry about how to position the keyboard that you have.
Sure. Yep.
So
lower typically the better.
Right. Because you don't want to be up here. This is where you're going to get symptoms, and you really can't go much lower than this. So
right, if it's on your lap, and I've got one. I really like that. I use it on my laptop.
Yep,
It's got
works
all
so
those,
good.
all the squishy little foam
Beads. It's got
mine got the bead one.
Beads.
Yeah, it
Oh,
formed
wow.
over my legs really well.
Lonnie, you got anything?
It's purple too.
How about side flipper pillow?
Side.
Oh yeah, like those pillows you hug.
Yeah.
Yeah, those are great. Those body
The
body
big
pillows.
long ones.
Yeah.
Yeah.
I love those. Those
Yeah.
are great.
We should get one someday. In here.
Yeah, we really should.
I've had a lot of patients use those and be very happy. I haven't personally used one myself, or my wife hasn't, but
So Hannah made the comment that going back to the keyboard thing,
Oh.
she has arthritis in her wrist, and she found the downward positions the best for her.
sure.
So thank you for supporting us in our beliefs. So
The other thing about keyboards, some people aren't aware of, Bob, is there's usually two tabs on the bottom of the front of the keyboard that will flip the keyboard at a different angle. And you may want to work with that if it's too high, or you might want to type for a while with it down and then flip it up, and every hour or so flip it so you have different positions of your wrist.
that's a good idea.
Where did you get the balance stick?
The balance stick, Bob.
Oh, that's
They
going to be
caught
coming
us.
out.
Yeah,
We're going to be coming out with that soon.
yeah,
So-
that's in the works. We're
Yeah.
just testing right now.
Yeah, we're testing it right now.
So just stick with us for a few more weeks, and we're gonna give a full-blown demonstration.
Someone's having problem with C4, C5, and they're getting pain in their arm, and they're wondering how to sleep with that position. First off, I would make sure you're treating it.
Right.
And We have videos on this. If you type in Mackenzie, MCKENZIE, for the neck, that's going to design to help try to take away that pain.
Right.
But as much as possible, I do want that arm supported when you have a C4, C5 problem. Even when you're during the day, I want you to put a pillow underneath. This is the first thing I show someone that has a cervical radiculopathy or pain down their arm.
Mm-hmm.
I say, you sit, even when you're sitting around like this, I want you to have a pillow between your underneath your arm.
And it typically feels better.
It feels better and gets that calm down, so then maybe you can sleep at night better. Sleeping at night be the same thing. I want you to support that arm somehow. If you're laying on your back, put a pillow underneath it. Try to find a position that feels good. Laying on your side, again, couple pillows. Because if you go down like this, it's putting stress on it. So,
and particularly how you adjust your pillows for your neck, and that's where the cervical roll inside the pillow, which I just took out, that's a really important part to address, as well as the arm pillows. Like I just put one in here. But whatever you do, anything that makes the arm feel better is a good position that's going to help you out. So we want to get rid of the arm pain first.
Someone just mentioned that they just hurt their back and their straight leg raise is fine, so they don't think it's a disc problem.
Okay.
Despite that, even with that, I would still do, usually what we start having people do, most people do, is lumbar extensions. Yeah, we try this first. I don't care what your back problem is, unless you already know that you have spinal stenosis, spondylolisthesis, or DDD, maybe,
right? Yeah,
degenerative disc disease. This is my go-to position to try. And what you're going to want to see is the pain getting better when you do these.
Right.
And don't lift up your pelvis like this. You're trying to bend the back further and further, and eventually get way up in here. But this is the go-to position, because generally with your back, most people, the way they hurt their back in the first place is bending forward like this. So we're going the opposite direction to try to help heal it.
Balance out that range of motion.
Right. For shoulders, I have my mattress on the floor. Then I have a built-up platform for the pillows, so that I have a proper canal for the shoulders. So they've made it kind of their whole thing. Somebody must not have seen our program earlier, because they're wondering what to do with a shoulder problem when you're lay on the painful side. Again, you want to create the canal. You got two pillows. You're going to put your shoulder right between like this, and this takes a lot of the stress off the shoulder. So you can rewind this too if you go back on YouTube.
Yeah, just take your mouse and it's kind of fun to go in fast motion anyways.
Lonnie, you got anything?
Here's a question. Can you get acid built up in your lower back?
The question is, can you get acid buildup in your low back? I would say no.
I don't wonder if they're talking about if you sleep on your left side versus your right side. One side kind of can promote some reflux, acid reflux.
Oh, I see. I never even thought of that. Acid reflux, maybe?
Yeah.
I can't
And
remember which side it
unfortunately,
was,
off the top of my head, I don't remember if left side or right side. Boy, I was just looking at that too.
Yeah, there's one side that is better. You have to look that up for if you have acid reflux.
Right.
There's a side that you want to prefer to lay on. So.
And you'll know because it's the side that feels better. It's what you want to lay on as far as your acid reflux. Lonnie, look, you're pretty perplexed, sir.
Someone's talking about the Mackenzie exercises for neck, and she said, we do extensions, but once the neck is extended, you don't do the side pendulum movements like looking upwards. I don't know what she's talking about. Is she talking about these? I know the thing is with Mackenzie, you got to follow it step by step, because sometimes it's not extension that they want you doing. Sometimes the one that works for me, by the way, is I do a chin tuck, and then I go to the painful side. So if I'm having pain down this side, I do chin tuck and I go to the side. What you're trying to find out is what position works to reduce the pain.
Right.
It's always the method you want to take. Yeah, Mackenzie has a book, and this is just excellent. It's Treat Your Own Neck by Robin Mackenzie. I would highly recommend these books. They're very, very good. They're written for the layperson. And to be honest with you, a lot of times you wouldn't even need us if you read these books.
Right. They're not real expensive, but I think they're around $10 range.
Right.
Somewhere in there. And he's got one for the back, one for the shoulder, one for the neck.
Yeah.
and they have nice illustrations. And
Yeah.
Mackenzie, you know, as
Just
far as
really
we're
well
concerned,
done.
He's the master.
Yeah, he's the master's, right.
Okay, there's a question from Fiona Anderson. So her MRI showed bulging disc at L4 and L5, and then she have when she wake up in the morning she could hardly walk. So pain on the side of her legs is unbearable despite taking 2 extra strength Tylenol.
So she's got a bulging disc at L4, L5, and when she gets up in the morning, she can hardly walk. So this is what I want you to try. What was her name?
Fiona Anderson.
Leona?
Fiona.
Fiona, this is what I want you to try. Before you even get out of bed, I want you to get your back warmed up a little bit. So you're going to be laying like this, and this is one that almost anybody can do. The bulging problem, it might not be causing the problem. One thing you have to realize, we find bulging disc and herniated disc in people who have no pain. That's found all the time. It's a part of aging. So don't get too hooked up on that. Try to find the positions that are going to help you take away the pain. But the first thing I want you to do in the morning is get your back warmed up before you even get out of bed. I want you to rotate your hips back and forth like this. If one direction hurts, go in the other direction. Just go the other way. And eventually, even what I want you to do when you get out of bed is I want you to roll onto your side like this and get up like this. I don't want you getting up like this.
Right.
Because that'll can actually hurt your back while you're getting up. So after you've warmed up your back for about 5 minutes, then get up like this. And then even when you stand up, you might even do a couple extensions like this to get things going. Or you take the towel like this, right, Brad?
Well, I'm thinking if she has the pain getting out of bed, it might be a position problem.
Oh, sure. She might want to use the supports.
Right. So you probably don't have one of these, the sleep roll, but you can make one like this, like we talked about. We went through this earlier in this video. You can rewind it and put it around here, and you may find sleeping with support in that lumbar spine will help that disc from creating the pains. So it was here, and if I don't if you're a side sleeper or not, but you tape it or pin it here all the way around so that you get that support whether you're on your back or on your side. So we hope that helped out, Fiona.
Now Lily, she's saying she's going to look for the McKinney video. It's Mackenzie, MKMC.
Capital K, actually.
Yeah, MC capital K ENZIE. Also, they said this ice. Someone, Kaleem Ahmed, is wondering if ice works for immediate injury. Yes, we recommend always ice, especially in the first 24 to 48 hours for almost most injuries, because there usually is some swelling, and the ice usually does feel really good.
Get that swelling down.
Lonnie, if you have one more, we'll take one more. If not, all right. Well, let's call it, Brad, because
we got work to do.
So thanks for watching. We'll be back next Thursday.
Be careful. Sleep well. Get it.